I'm Deborah Connatser. I'm a dermatology nurse practitioner here at Southeastern Dermatology with Dr. Matthew Doppelt. And May is Melanoma Awareness Month. And melanoma is a really important factor in all of our dermatology practices. And it's a condition that affects young people, not just those who are 70 and 80 and older. Melanoma is the second and third most common form of cancer in people in their 20s and 30s. And so if we catch it early, it's very treatable, but you have to catch it early. So I want to mention to you a couple of things about screening. When we're doing skin checks on individuals, there's the A, B, C, D, E's of melanoma, but sometimes that can be hard to keep up with. So really, everything's like Sesame Street. One of these things is not like the other. And so if you have a spot that looks different or acts different than your other spots, those are the ones we want to pay extra special attention to, because chances are you're not going to spring up with a bunch of skin cancers at once. You're more likely to have one. The current statistic in the United States is that they estimate 1 in 5 Americans will develop a skin cancer, not just melanoma, in their lifetime. And the estimated risk of melanoma right now is 1 in 55. Melanoma only accounts for about 3 to 5% of skin cancers in the U.S., but it accounts for 75% of the skin cancer deaths. And so while it's not as common, it can be a lot more dramatic as far as your long-term health is concerned. So if you have something that you're concerned about, see your dermatology provider. We'd rather see you a dozen times and say, that looks great, than to see you once and go, oh my gosh, I wish you'd have come in sooner. Sunscreen is also really important. You can't undo the damage that's been done, but we can be proactive about protecting ourselves in the future. So as far as sunscreen is concerned, we want you to use something that's SPF 30 or higher. You're supposed to apply it 15 or 20 minutes before you go outside, not when you're on the ball field already. And then reapply it every 1 to 2 hours. All sunscreens have to be reapplied. The more fair you are, the more frequently you should reapply the sunscreen, but it all has to be reapplied. And remember other things like sun protective clothing. You don't have to reapply clothes, they're already on. Hats are really important, and don't forget to protect your eyes. So sunglasses are great too, because not only does UV affect our skin, it can contribute to cataract formation later in life as well. So protect yourself, be proactive with your health. Your skin is your largest organ, so protect it and protects you.